This program does not necessarily reflect the views, opinions, or policies of the City of Oceanside, its elected officials, KOCT, its board of directors, or staff.
Hi, my name is Betsy Heitman, and I'm the Development Director at Vista Community Clinic. 2012 marks the 40th anniversary of Vista Community Clinic, so what a great opportunity for us to share a little bit about what we do to you. I'd like to introduce to you Sonia Jimenez, who's a clinic manager, and Dr. Rebecca Corneal, who's the director of our dental department. Thank you both for joining me. Sonia, would you please tell us a little bit about who utilizes the clinic services and what those services are that we provide?
Sure. Vista Community Clinic has been providing low-cost, high-quality healthcare since 1972. Our patients include 1 in 4 Vista residents and 1 in 8 Oceanside residents. We also serve nearby communities ranging from Carlsbad to Fallbrook. Our clinic offers a wide array of services, ranging from everything from pediatric services, which offer child exams and sick visits. We also provide care for adult patients. We also provide care for our prenatal patients, which consist of everything from nutrition visits, from social worker visits, comprehensive care from a health educator, from physicians and nurse practitioners. We have family planning care, which allows patients to be more involved in their reproductive health care. And we also provide services for patients for their dental care. And we also have a wide variety of programs that help patients apply for programs such as Low-Income Health Program and Healthy Families Assistance.
And where can people find Vista Community Clinic in the neighborhood?
Vista Community Clinic has 5 locations that provide primary care. 3 of them are located in Oceanside and 2 are located in Vista. Our Vista locations are on 1000 Bell Terrace Drive, 134 Grapevine Road, and then our Oceanside locations are on 4700 North River Road, 517 North Horn Street, and 818 Pierview Way.
So when you speak of prenatal services, share a little bit about what that means.
Sure. Prenatal services is care for someone who is pregnant. So we encourage our patients to come in and see us as soon as they find out that they're pregnant, so they can start getting treatment as soon as possible and start caring for both themselves and their child. When a patient comes in and enrolls in our prenatal program, they can see a health educator who is going to follow them throughout their care and really be their liaison to get them the care that they need. In addition to working with this health educator, they're going to teach them about what to eat, how to care for their child, what to do during their pregnancy, what to do after their pregnancy. They'll advise them about what things to look out for, what kinds of things they need to communicate to their healthcare provider. And it's really a team that is being created amongst the patient, the health educator, and the provider that is caring for them.
And when you speak of a team, there's also care teams at the clinic, correct?
Correct. Yes, and so a care team is basically a team that is established to help provide for continuous care for the patient. It's much more efficient when the medical provider that you're seeing on a regular basis already knows your care. And so obviously if you come in with us, we want to make sure that we know what's going on with your care. We want to make sure that we provide the best care for you. And so we're going to do that by making sure that you see the same people every time that you come.
That's great. Dr. Corneal, in addition to the services that Sonia shared, can you tell us a little bit about the dental department and the patients that you see in there?
Sure. Our dental department is divided into 2 locations. The majority of our patients are seen at Vale Terrace branch. We have a much smaller location at the Grapevine location, so they can schedule appointments, whatever's most convenient. We have 15 dentists on staff, and we provide the majority of the general practice type procedures that general dentists do. We focus our care mostly to the vulnerable populations, which include children and pregnant women, and also patients that might be also dealing with systemic issues that could compromise their oral health. So we're able to take care of the whole patient.
And I'm sure you do a lot of education to tell people that now is the time for that preventative care in order to not go into any other infections that may occur throughout their body, correct?
Yes. What the great part about practicing as a dentist in a community clinic is that we can truly care for the whole patient. So it starts with the moms in prenatal, and as soon as they find out they're pregnant, we get them up into the dental department to have them screened and start taking care of all their needs. Once the child's born and they're in the pediatric department, same thing. We kind of help grow the patient. So they're coming to see us from a very young age, from the time their first tooth comes into the mouth, which can be around 6 months. And we can start educating the parents on how to care for their teeth, how to control their diet and their nutrition to prevent cavities, prevent any sort of oral disease. And the same thing with the pregnant women. We can help prevent the transmission of decay from mom to child through the sharing of utensils and cups and things like that.
That's great. And convenient hours?
We're open Monday through Friday, and the hours vary depending on the day, but we do offer evening appointments as well as Saturday appointments, so we can pretty much fit in and work around almost anyone's schedule.
And you've been providing dental services at the clinic now since?
Almost 2 years now, so since 2010, the fall of 2010, but the dental department has been in existence for much longer than that.
That's great. Well, thank you both very much for joining us, and the number's on the screen, so anyone that has any questions can certainly reach out, and I'm sure specifically contact either one of you for some further information. So thank you both so much. At this time, we're going to take a break, and we'll be back with Nanette Stam, who is the Assistant Director of our Health Promotion Center at Vista Community Clinic.
Winston, just one more inning, Grandma.
Ever notice how many things today kids can do without actually moving? A whole lot of things their parents used to do the hard way. So many kids' activities today seem to leave out the activity part, which makes exercise even more important for children. In fact, new research tells us the best time to enhance bone development is during childhood and adolescence. And just getting children to walk an extra 35 minutes a day could spare them the pain of thinning bones later in life. Healthy bones come from healthy habits. Encourage your kids to get up, get out, and get moving.
Hello. Hey, Grandma, how about another grape soda?
A public service message on building strong bones for kids from the Pediatric Orthopedic Society of North America and the American Academy of Orthopedic Surgeons.
We're back from our short break, and joining me, in addition to Sonia Jimenez, our clinic manager, is Nanette Stam, and Nanette is the Assistant Director of our Health Promotion Center. So we'd like to share with everyone, Nanette, not only do we treat patients clinically, but we also have a number of programs that are available to our patients to help keep both them and our community healthy. Can you share a little bit about those programs?
Sure, Betsy. The clinic has a number of programs that you said that we offer our patients to help them manage primarily their chronic diseases. So we're talking about asthma, diabetes, hypertension, and I'd like to highlight just a few of those right now. We have a STEPS program, which is for our diabetes patients, and we're really looking at serving those patients with diabetes that have uncontrolled diabetes, that maybe they just found out they had diabetes or they've known and they just haven't taken care of themselves. So we bring them in, and it could take a few months to get them on track. We see them as often as needed in the first part, and then once they have controlled diabetes, we monitor them every 3 months. And some of the services we offer through this program include nutrition counseling with a nutritionist, case management and health education about diabetes from a trained health educator, an annual retinal exam, as well as periodic visits with the physicians and nurse practitioners.
You mentioned the STEPS program. What does that stand for?
Yeah, it stands for self-monitoring, so talking about monitoring your own glucose levels at home, treatment, so if they need to be on any insulin or things like that to help them control their diabetes, education, so learning about diabetes and how they can take care of themselves, physical activity, which is an important part of managing diabetes, and sensible eating, so it's really talking about the nutrition that goes along with taking care of your diabetes.
That's great.
Yeah. So a couple other programs we have are the Breast Health Program and the Wisewoman Program. And both of these programs take advantage of a state program called the Cancer Detection Program, Every Woman Counts. And this state program offers free clinical breast exams and mammograms to low-income women age 40 and older. And the Breast Health Program actively promotes this service to our women in the community. They go out into the streets to tell women about it, recruit women. They also schedule specific screening days on Saturdays that make it more convenient for women to come and get their breast exams. And then they also do support services. If a woman comes in, gets a clinical breast exam or a mammogram, and it becomes abnormal, we have staff that helps walk them through the process of what happens next, because that can be a scary situation for someone. And we also provide support groups if they do have a breast cancer diagnosis, because that obviously is even harder to deal with. So we have active support groups in both Spanish and English that help them deal with all the issues that surround a breast cancer diagnosis. Our Wisewoman program is our cardiovascular risk reduction program for women over 40 as well. We screen these women as they come in for those cancer detection screenings that I mentioned. So they can also get screened for cardiovascular diseases. So we're looking at blood pressure, cholesterol levels, as well as glucose. And Wisewoman is actually funded through the Centers for Disease Control, which is a national program, and we're one of only 7 clinics in California to actually have this program. And with heart disease, the #1 killer of women in America and in California, we're really happy to be able to offer this service to the women.
And we see, and Sonia, maybe you can speak to this a bit, all patients, whether or not they have insurance or don't have insurance, from men to women, correct?
Yes, we offer, services to anyone who is seeking care and who's seeking assistance. So men or women, or insured, underinsured, or not insured at all, we'll definitely see patients. And like we touched on previously, is we're open Monday through Saturday and offer evening and Saturday appointments to help patients as much as possible.
And how do patients pay for most services at the clinic?
When patients come in, we assess their family size and income and determine their eligibility for any programs. A lot of times we're able to enroll them into state-funded programs, or if they don't qualify, we can look to see if they qualify for our sliding fee scale. But we're able to see patients whether they're cash paying or they have a program to cover further services.
And Nanette, in addition to the 3 programs that you spoke of, how many other programs are out there for our patients in the community?
We have a wide range of programs, not just for our patients, but we also offer community programs that you'll hear about a little bit later in this segment, like after-school programs. But we also offer programs for farm workers, for our patients who are at risk for HIV or who have HIV. And we also offer another program for our clinic patients, which is the asthma program, which is a program that covers the cost of the doctor visit and asthma medicine for any child who does not have insurance, which is really a great resource, because we know that with asthma you can't cure it, but if you're able to know what your triggers are and have the medicines on hand, then you're able to really be able to live a healthy life even if you have asthma.
And I'm sure that's a huge relief for the parents of a child that presents with asthma, knowing that you do the education as well as treat and keep them healthy.
Yeah, definitely. And so there's no reason why a parent should not take their child to the clinic. Insurance, whether you have it or not, will be able to treat the child.
Great. Well, thank you both so much for joining me today, and we'll be back after this short break.
At what age is the color that your skin was meant to be no longer beautiful? Every year, millions of young women try to change the skin they were born with and say they'd die for darker skin. Sadly, some actually do. Melanoma is the second most common cancer in teens and young adults 15 to 29. And one person dies from melanoma every hour. It's time. Change your thinking, not your skin. Stop tanning. Learn more at spotskincancer.org. A message from the American Academy of Dermatology.
We're back from our break, and we're now joined by Maria Yanez, who is our Youth Development Program Manager, as well as John Moffat with our Cyber Education Project. Maria, we hear time and time again about the youth in our community and what great work the clinic does with youth development. Can you share with us what that means and maybe a story or two where these youth would be if they did not have youth development as part of their life?
Interestingly enough, we have several youth development programs, and just to clarify, there's a difference between just after-school programming and what we consider to be youth development programs. Youth development really looks at trying to look at where the youth is and being able to access a lot of the services that they need, working with the families to be able to find the things that they can access, and then be able to also progress in their abilities to excel. We try to wrap around many services around the youth. We look at, where they are academically. We also look at where they are as far as their finances in their homes. Are there needs there that we can help them with and refer them to? We also look at some of the issues that are happening in their community, local community, sometimes neighborhood-based. Sometimes there's violence that's happening that we can help them address. So in our programs, we try to address all of those needs with the youth. One of the programs that we have that's probably one of our more successful and long-standing programs is the REACH program. We have different versions of the REACH program. There are after-school programs, again, youth development programs, that provide an array of services for the youth. We work with the kids on their academics, as I mentioned earlier, look at where they are academically, are there areas that they need some assistance with, and then we work with the schools to try and address some of those needs. We'll get the report cards from them. We'll find out if they're passing their tests. We'll assist them with their projects. We'll also monitor their abilities to read, write, and then do their math. We bring in tutors to work with them and do all those kinds of areas of academics. On top of that, we provide them with life skills education. We have an array of curriculum, from violence prevention to healthy relationships to communication to employment readiness to just different things that you can think of when it comes to youth as to what their interests may be. We even try to bring in some artists to work with them on those as a way of expression, again, communication. In addition to that, we also have recreation, kind of a healthy fitness program that we do with our youth in addressing some of the more health and chronic conditions that our youth may have. So we have some students that may have some issues regarding asthma, as was mentioned earlier, and then maybe diabetes that they've been pre-diagnosed already. Maybe the issue of obesity is in their family, and we try to address that with them. So we do a lot of recreation activities with them. And it's not just going outside and playing, hitting the ball. I mean, the kids love to play dodgeball, sports, soccer, football, flag, an array of things that we do with them. It's also taking them on experiences they may not normally do. Some of our programs are inland, and the kids don't get to go and access the beaches. Take them to the beach. Actually experience what that may be like. We also have some programs where we take them down to Torrey Pines. We find ways of transporting the kids down, being able to have a hike, actually know what it's like to do a nature hike and go through there and see some of the experiences there. Aside from REACH, that's our big program, we have 4 sites. We have 2 that are school-based programs in the city of Vista, and then we have 2 that are community-based programs in the city of Oceanside. We service over 120 kids every year. There's new kids that come in and some kids that return year after year, but that's our biggest program there. In addition to the REACH programs, we also have our Step Up Mentoring program. Another big program that we've been very successful these last 2 years with that program is they came in and we were able to start working on mentoring for the first time in Vista Community Clinic, as far as I know, is to be able to come in and be able to provide adult mentors that work with high school students who then in turn mentor a middle school or elementary school student. It's a 3-tier mentoring program. We're able to get a lot of the benefits from it. And you asked for a story. That's one of probably our best stories is the kids that have been working as junior mentors, we call them, or high school students. They receive the benefits of having an adult come in, whether it be a college student, a paraprofessional, or a retiree who wants to spend 2-3 hours a week just to kind of help them with whatever situations they'd be having with, just to talk or to come in and do a class with them or whatever it may be. And then they in turn go and talk to other younger students. And what we've heard from some of our students in some of the surveys or some of the responses or the interactions I've been able to have with them is that they actually share about, I've never been considered myself as a mentor. I've never seen myself as a role model. And here I am being told by, an elementary school student or even a middle school student, I look up to you. you have something that you offered me, and a lot of our kids have been able to turn around. Some of our kids have shared about, some possible situations where they've had, people offering them drugs, or, some of the gang issues that are happening in the city of Oceanside that may have come up for them, or some of the recent violence that, tragedies have happened in their neighborhoods. They're like, this is impacting them, but knowing that they have some sort of mentoring that's happening has made them be able to process some of that information, seek help, be able to communicate and express some of their feelings, and then be able to come back and then give that same to somebody else.
It's amazing. And these are all part of Vista Community Clinic, the programs that you spoke of.
Yes.
Explain what REACH stands for.
REACH is an acronym. It actually reflects all the different components of the program. REACH, the first one is our recreation. Again, I mentioned briefly about some of the exercise activities, the Healthy Family. We actually do some things with them. So we address recreation with them. Then we have the E, which is employment readiness. This is where we take the opportunity to work with kids on looking at what prepares them for the job market, whether it be actual job training skills that they're learning to do, internships, or maybe even looking at the opportunity of assessing what colleges they want to go to for employment purposes at that point. So we do a lot of those activities. Then A is for academic. We look at the academics. We talk about tutoring. We talk about working with the schools and assessing where their progress is academically. C is communication. Communication being all aspects of the communication, peer communication, relationships, parent-child communication, every aspect that you can think of, how you express yourself inwardly as well as outwardly. And then H being healthy relationships. And that's all of the other curriculums that we talk about when it comes to anger management, healthy relationships. Some of our teens, especially our older teens, are looking at dating. So we talk about address that, and then their own internal stuff.
John, cyber education. You hear a lot more nowadays about cyber and the internet. Explain a little bit about your program that the clinic provides.
Thank you very much, Betsy. I'm happy to be here to talk about this. The cyber education program, a lot of times when people think of the Vista Community Clinic, cyber education doesn't necessarily pop into their head right away.
Sure.
But our program actually started in the REACH program. I worked in the after-school program, and we noticed all the kids were jumping online, talking about the parties, the drugs, everything else. We created an initial presentation to raise their awareness of the dangers of what they're doing. And it was very successful. It was so successful it led to several grants. Those grants unfortunately ended, and now we do fee for service. What's exciting about that is we currently are partnering with Oceanside Unified School District and doing presentations to staff, parents, and students. So we encompass every aspect of from the child, from the second they start to the very end. And so that's been very successful. We're going to continue that in the fall. So I'm excited about that. We educate youth ages 4th grade through senior citizen and everyone in between. And we customize each presentation to fit each group's needs. So what we found when we first started, when we had grants, is we would have anywhere from 90-minute to 5-hour presentation, and we go, here's what we need to provide, and they'd be like, well, I don't have time for that. Well, now we come in and we go, where are your needs? How can we help you? And we put it together that way. And it's been extremely successful. Moving forward and looking at what's encompassed in this presentation is we really focus on everyone now on the planet has 2 reputations. Their real life reputation, that's one I see in front of me. How are you doing, Betsy? It's nice to see you. And then we have a digital reputation, and that's how you're viewed online and through digital media. Do those reputations match? And how can you address those issues? So we first look at what makes up a digital reputation, and that's your cyber identity, whether it's social networking like Facebook and MySpace. MySpace sort of died a while ago. Twitter, ForumSpring, whatever it happens to be. And we look at those and how they can impact a child's life. When I do a presentation, I usually ask the audience, who here has over 500 friends? 20% of the kids raise their hand because they're super cool, right? And then I'll ask, okay, how many have less than 500? Fewer hands raised, until finally I get down to about 20 to 25. And then there's 1 or 2 kids, and they're getting laughed at, sort of like, well, you only got 2 friends.
Sure.
And that's the one that is the safest web page. The fewer friends you have, the more likely your page is safe. Now, nothing's 100% safe, but when you have 500 or 600 friends and several of them are Snoop Dogg, he's not your friend, my sheezy, my neezy. You understand? So on one hand, that's something that people aren't really aware of. So we talk a little bit about that, and then we look at blogs and vlogs. And the hot topic right now is cell phones. When I talk to parents, when should I get a cell phone for my kid? And I think back to when I was a kid. I used smoke signals till I was about 15. And that seemed to work out okay. But really it comes down to each individual's family and where the trust is, how they want to use it. But it is a personal computer in their pocket if it's a smartphone.
Could be a dangerous tool.
Yes, and anything accessible, if it's connected to the internet, it connects to the whole internet, not just what their parents want them to see. So I know we've done focus groups with kids, because at every school we go to in a school district is we meet with groups of students at different age levels and pick their brain about what they're using, how they're using technology, so we can make the presentation customized to fit their needs. And what we found is pretty crazy. You know, how many of the students, when we did a middle school, how many have actually stumbled across inappropriate content? What did they do when they saw it? The stuff they're seeing in the questions they ask freak me out, and I've been working with youth for 15, 16 years. So imagine if a parent had to talk to their kids about it. So we do a section in the parent presentation on how to talk to their kids about it. And the simplest way is to have a conversation with your kids that you're a little uncomfortable at having is not at dinner. That's gross, because it could get awkward. It's in the car. Because when you're thinking about it, you're driving. First off, you have to avoid swerving into a tree when you hear some of the questions they're going to ask. But it allows kids to be a little more open because they're not making direct eye contact. A lot of times you're sitting around the dinner table and go, hey, so what'd you learn today? What'd you see on the internet? Dude, stuff. Everything was great. We looked at angels. You know, they're not necessarily getting the idea of how dangerous it is, or being able to process what they're seeing. So we sort of look at it in that way. And the last but not least, we also include video games.
How does that play into it?
Well, now that video games are played online, kids could be solicited. And I was surprised when I did fourth grade and fifth grade to hear how many have actually been asked through the video game system, hey, where do you live?
Really?
How old are you? And really educating them on the dangers of communicating with that person. Now, a lot of the kids will go, yeah, I talk to them, but I lie. I use fake information. I joke around. And I always tell them that within that fake information, there's usually some truth. No. Well, for example, if they ask you what time it was and you told them the real time, you don't think anything of it, but that gives away your time zone.
Correct.
So it's little piece of information that they're not necessarily paying attention to. So that's what we focus on.
Well, you both do such a fantastic job in assisting the youth in our community and ultimately, the clinic and all that we do. So I want to thank you so much for joining us.
Thank you.
Thank you.
And I want to remind everyone that our annual Holiday Homes Tour event this year marks the 26th annual Holiday Homes Tour, which benefits Vista Community Clinic, is being held on Sunday, December 2nd, and tickets will be available in mid-September. To contact the clinic, please call 760-631-5000, extension 0, or you can visit our website at www.vistacommunityclinic.org.
This program does not necessarily reflect the views, opinions, or policies of the City of Oceanside, its elected officials, KOCT, its board of directors, or staff.